Ali Cupper, member for Mildura. Great to have you with us again on Flow.
Thanks, Ricky.
Last week in Parliament, you asked questions of the Health Minister about the Mildura Base Hospital. There was an announcement of a new health plan yesterday, but first of all, what was the answer the Minister gave about the future expansion of that hospital?
Yeah, so look, I pointed out to the Minister that, we have a major issue with the built infrastructure with the hospital, so that our work is not yet done. The first thing that I worked on when I was elected was to have the management returned to public because it had been in private hands with a for-profit contract for more than 20 years. But I made it clear to the Minister that as excited as we were, and it's been 1 year and 1 day exactly since the return to public management.
Yep, that was something you described in the preamble as a travesty, that it was. Is that right? That it had been previously in private hands?
I've used a whole lot of terms that are similar to travesty. I'm not sure if it was travesty or not, but yeah. I have been highly critical of the fact that we've had Victoria's only privatised public hospital for nearly 20 years. La Trobe was briefly privatised, but returned to public management very soon afterwards. Whereas we suffered through that private contract for a very long time. So travesty is one word for it.
And so the Minister said in response, he acknowledged some of your concerns, did he?
Yeah, he acknowledged the concerns. You can't, he acknowledged that there are limitations to the site. You can barely build out, you can't build up, you can't build over the road because that's a rubbish tip. So he acknowledged all of that, and he said that he understood that, because of the unique nature of the private contract for the building, which didn't require any obligation for the owners to improve the building over time, that Mildura is in a unique position where to deliver decent healthcare, we need a new building, and he said he's going to speak to the Treasurer about that.
Okay, so there's no commitment at this stage for a new site or a new build. It's just a matter of the government still looking at that side of things.
Well, we're lobbying for it.
Yeah, so then coming to this health plan that was released yesterday, it's the Mildura and Northern Mallee Regional Health Plan, I think is the correct title. It gives a pretty poor assessment of the health of the community as a whole there. Well, certainly indicates there's some serious health issues in your electorate.
Yeah, well, we're isolated, and isolation always exacerbates issues. So we're a very strong, proud region, and we do the best we can with what we've got. But when you're a long way away from a capital city, and when you've had sort of the core of your healthcare system, essentially running for profit for 20 years, and having a more insular, rather than a public-facing or certainly a service-facing collaborative approach, then you struggle.
Yeah, it would seem to me from what the analysis they've got there about chronic disease and the like that you're probably worthy of more spending than the average per capita because of those serious health needs in the region.
Yeah, well, that's right. Exactly, that's the argument. And that's what's been identified here. That and a lot of the information that's been gathered as part of this $1 million service plan review is designed to be fed back to the new public board of Mildura Base Hospital, so it can be very well equipped with all the information it needs and current information that it needs to make decisions. To maximise, improvements and turning around some of those indicators.
And you mentioned, I think, in your preamble of your question that there'd been better morale now the hospital system was in public hands. And this report, the plan indicates that there's a need to retain and attract professional staff. Is that something you're hearing across the board as well in your area?
Yeah, all of that. All of those things are important cogs in the machine. We want to be an employer of choice. We want to be, viewed as kind of like, the Alice Springs of Victoria, where you can come to an isolated part of the state, and that's the appeal. That's what's exciting about it. It's a long way away. It's very unique. There's a whole lot of complex health issues that you can look at and examine and to know as a doctor or a nurse or otherwise, healthcare specialist. So that's what we want to sell, and we're in a much better position to do that. One of the first things that happened when the contract switched from private back to public was that all of our staff had access to salary packaging, which they had not had for 20 years because it was a for-profit private company. So it's those sorts of little things, and just more of a management focus on staff and their needs. when you're trying to make a profit, sometimes things, fall by the wayside a little bit. And certainly that was some of the feedback we've been receiving from staff for a long time. And staff are absolutely demonstrably more happy, feeling more valued, and their pay packets increased by thousands of dollars the minute that contract ticked over.
Well, I think if I got it right, we're about 14 months from the state election. I got that right?
Ish. It's in November next year, so yeah, that's roughly right.
It might sound a bit scary when I put it in that many months, but it's coming soon, so I'm sure health will be a frontal topic in the local electorate as we get closer to that election.
No, that's right, it will be.
Well, Ali Kappa, Independent MP for Mildura, great to be chatting with you again on an important topic of health for your local electors.
Thanks, Ricky.